Good afternoon. We'll now start the pep talk for today. I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group picture taking at the start and end of the pep talk. So please show your face in the video. As a reminder, please take the online Learning Cum Evaluation Test exercise or OLETE and get a perfect score to get a certificate like the one shown below. I have placed the link in the chat box as well as in the Viber group and also in the Facebook group. Another reminder, 50 OLETE certificates will entitle one mentee to a free voucher for ROJoson telemedical consultation, like the one shown below. And then another request is for those who are not taking the OLETE, please put your feedback in the chat box during the open forum, so they'll be recorded also. Thank you. So let's now have a group picture taking before we start the pep talk proper. Okay. Ready? Everybody's ready. Ready? One, two, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm. My pep talk today is entitled Medical Records, Generate, Keep, and Archive. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the importance of keeping and generating and archiving medical records in their management of their health. The contents of the pep talk today will be the following. What are medical records from the lay people's perspective? What are the common types of medical records? What are the uses of the medical records? Why is it important for the lay people to generate, keep, and archive medical records? And what are ways of generating, keeping, and archiving medical records? And then lastly, my advocating statements and advice on medical records. So let's start with the first topic. What are medical records from the lay people's perspective? Medical records are documents that contain the history of what transpired, so what went on in the person's health from birth to death. From birth to death. I repeat, from birth to death. The documents can be generated by a person, himself or herself, if she has or she has the capacity to do it, such as if he or she is physically and mentally functional. This is to contrast it to a baby who cannot do it, to a person with dementia, in coma, etc., So who will not be able to generate the medical records. But for those who are functional, they should do it. Okay. So if a person is not physically and mentally capable, then a guardian has to do the generation of the medical records for the benefit of the patient who is not capable because of the importance of medical records. If the person is physically and mentally capable, he, she can and should generate medical records through a personal journal. Okay, that's one way on the history of his symptoms or health, a personal diary or journal. Another way is that he or she can and should be able to keep and compile all the medical records coming from physicians and other healthcare professionals whom he has consulted, and from healthcare institutions such as hospitals, diagnostic and treatment centers, where she receives some form of medical services. So two types of medical records that can be generated. Okay. The medical records can be generated in the following forms and media. Okay. In terms of form, either handwritten or typewritten. In terms of medium use, either hard copies or digital copies or computerized copies, okay, or even picture. Okay. The specific types of medical records that a person can generate, get, keep, and archive are the following: personal health journal, medical clinic consultation notes from physicians and other healthcare professionals, hospital records when confined, diagnostic test results and reports, treatment records, and others. So this just shows an example of a personal health journal. Okay, this is an example done by me. So the journal contains the following: the name, the sex, the age, okay, then vaccination, immunization history. Okay, since usually we don't have these records, we try to recall. Okay, so example here, I had basic vaccination, immunization when I was a baby or a child. At least I have BCG, DPT, polio, measles. Then I didn't have any booster in tetanus toxoid ever since my vaccination, immunization in childhood. Then I don't have any hepatitis B vaccination because all my tests from 2011 up to 2016 showed that I have non-reactive, okay, HBs antigen test. And then I don't have any flu vaccination up to now. Okay. But in terms of COVID-19 vaccination, so these are my records. Okay. So I had the primary vaccination dates were on March 10 and then June 2, AstraZeneca, and then booster December 10, Pfizer, and then May 24, 2022, Moderna as the second booster. So part of the content of the personal health journal will be to put down the past significant illness. So in terms of major illnesses, I don't have any hospitalization ever yet, luckily. No major surgical operation also. No major significant illnesses yet. And then for the minor one, I have excision of epidermal cyst done by somebody, again. Excision of warts also done by somebody, by a doctor, okay. And then I had this plantar fasciitis, okay, in 2014, 2015, lasting for about a year. So it disappeared late to 2015 after I did stretching exercise, particularly lunges. No recurrence up to now, still doing daily lunge exercise. Another minor illness will be mucosis, as seen on the right-hand side of this slide. Okay, so I had this history of mucosis on and off, but since the last aspiration was in 2017, okay, 2017, so it was resolved after repeated aspiration. So up to now, there was no recurrence. Okay. So these slides also show the importance of pictures, okay, of some parts of your body, which you have to incorporate in the personal health journals. Current health status and concerns should also be part of the personal health journal. So the medical conditions at present will be, I have carpal tunnel syndrome, more on the left hand, mucosis, right? This time it's the fourth finger. Earlier, the one that has been resolved was on the thumb. Then I have hypertension. I am on amlodipine. And then I have benign prostatic hypertrophy. I'm on tamsulosin and finasteride. Okay. So the personal health journal is long, so I just take an excerpts of those of that journal. The details can be seen in the link as shown in the slides. So I also include the overall assessment of the current health status and concerns. I made a decision assessment that I'm still healthy and functional, but with some non-crippling medical conditions. Okay. And then resolutions also should be part of the personal health journal. Okay, if you're really serious on maintaining your health, okay, healthy lifestyle, exercise, diet, weight and waist watch, medications, etc. So these are the that's the sample of the personal health journal done by me. I think there are other people who are doing it, but very, very few. Okay. Now, sample of medical consultation notes from physicians and other healthcare professionals is another type of medical records. Okay. So this is the sample. Usually, this is what the sample of the medical notes that I usually give to the patient also. Okay, I have my own, and then the duplicate, I give it to the patient. So the challenge really here is that almost all physicians do not give patients records of the medical consultations. Everything is verbal. But when you are hospitalized, they usually have, and even in the emergency room, you should have the medical records, but it's only in the clinic that doctors usually don't issue out medical records. Okay. This is an example of a clinical abstract, part of the hospital records, okay, when you're confined. Sample of a discharge summary, okay, again, when you are confined in the hospital. And then the other types of medical records are the diagnostic test results, reports such as results from blood tests, ultrasound, CT scan, etc., okay, which usually are given to you when you go through this test. Treatment records such as operative and endoscopic records, which are prepared for you, and then you should be able to get a copy of those records. And others like medical certificates are also considered as medical records. As mentioned, medical records are historical records which a person and healthcare professionals can look back to help manage the current health problems, especially when there is a relation to the past health problems or influence from the past. So a doctor would usually like to see what is your past history. Okay, so it might be related to your current problem. Okay, and then medical record can also be used to facilitate compliance to organizations which ask for health history records. Example, when you apply for a person with disability ID or benefits, you need medical records. Okay, insurance, work application, travel requirements, school requirements, etc. Okay. So these are the uses of the medical records and why it is important for us lay people to generate, keep, and archive medical records. Generating medical records means making medical records by yourself via the journal, which I showed you earlier, or through a document or through documents or records that are supposed to be made for you when you have consultations in the clinics, in the hospitals, when you have diagnostic tests done, treatment procedures, hospital confinements, and other services done by a physician or healthcare provider or a healthcare institutions. Okay. So when you go through these services, you're supposed to have a record. Okay. The only problem is, as I said, the challenge is that doctors in their clinics, they don't usually give you medical records. Okay. But it's also important to have a copy. What are the ways of generating medical records? So one way of generating is to make a personal journal of your health history from birth to the current age, okay, the current symptoms, and not, as I said, these are usually not being practiced except for a few persons who know the importance of this practice. Okay. But this is a highly recommended way of generating medical records that one must practice. Okay. I put them in the link for the sample, so you can take a look there. So why is it important to have a personal health journal? One, it facilitates in self-diagnosis. You can use that to diagnose yourself and self-treatment in some cases. Okay. And then it can also facilitate in the process of medical consultations. And this is very much appreciated by the physicians. So if I see a patient with a personal health journal, I will say, congratulations, I like what you're doing. Okay, it helps me also in my evaluation of your health problem right now. Okay, number three, the importance is to it can help facilitate compliance to organizations which ask for the health history. The other way of generating medical records is through the documents or records that are supposed to be made by you for you, and when you have health or medical consultations, diagnostic tests, treatment procedures, hospital confinements, and other services done by a physician or a healthcare provider or healthcare institutions. Again, a lot of people do not take this seriously. Sad to say, the consequence is the inconvenience, the mga inconvenience of looking for these records when they are needed in the future. Okay, we have experienced this. Okay, not only on a personal basis, but also as a physician, okay, as a lay people and also as a physicians. Okay, so resolution is to make sure that you ask for all these records. Okay, once you consult all these people, okay, once you have these services done by the healthcare institutions, healthcare professionals, okay, ask for these records and then keep and archive them for future use. You won't regret it. The challenge is that, as I said, almost all physicians do not give patients records of their medical consultations. Okay, so what you are given is just a verbal explanation. Sometimes the explanation is also inadequate. Okay, so as I said, I usually give this type of a record. Okay. I jot down on my pad, okay, the data, okay, the name, the concern, the physical examination findings, okay. Example here, there's a thyroid nodule here, the findings here, and then, so the diagnosis is a thyroid mass on the right lobe, and then I start explaining whether it's cancer or not cancer, and then I told the patient that most likely it's not cancer. 90% it's okay, cancer. Okay, 10% not cancer. So they need options for further diagnostic tests. Okay. Okay. So you have the benefit, risk, cost, availability. Okay, options for biopsy or ultrasound of the thyroid gland. And then after explaining everything to the patients, I asked for what they want. So they chose biopsy. So I asked them to put down their signature as a kind of, as a method of informed consent. Okay. Then I did more explanation here. Okay. And then I give these patients, all the patients, a copy of the records that I usually make. Another example of my telemedical consultations, okay, so the age, the name, the date, okay, and then the concern, okay, post-mastectomy. Then what are the symptoms? Okay, no symptoms, none. Signs, okay. Inspection, no unusual bulges to suggest a lump. Palpation, no dominant mass palpated. And I give the primary clinical diagnosis, no clinical evidence of recurrence of breast cancer going 9 years for this patient. And then my recommendations will be the following: continued tamoxifen, continue self-monitoring, check-up after 3 months, and then prescription on the tamoxifen to be given. And then lastly, I said the findings, diagnosis, and recommendations were given, okay, explained to the patient, and these were understood and agreed upon by the patients. And then questions were asked and answered. Okay, so this completes the records, and then I usually give this patient a copy. Okay, so once they in the future, if they come back to me, they just present this record. If I don't have my own records available, or they can show it to the next doctor who will see them. Okay, so it will be helpful for the next doctor. So what to do in such cases in which doctors usually do not give patients medical records? I would suggest just ask. Okay, kindly or diplomatically or with politeness, just ask for a copy. Okay, so if not written, if you're not given a written copies, no, then ask for at least the diagnosis. Okay, that's the minimum, the diagnosis. Because a lot of times the doctors do not give the diagnosis to you. That's the issue. That's the common challenge that I see in medical practice. So then, if you are told about this one verbally, then you put into your journal the verbal explanations of the physicians. At least you have a documentation of what the doctor said, and then it will now comprise your medical records. Okay. Now, what are ways of keeping medical records? The first one was generating. Now we go to keeping. Keeping medical records means collecting personal medical records and then safekeeping them, both the personal journal and the ones given by the healthcare professionals and healthcare institutions. Again, the challenge is that a lot of people do not take this seriously. The consequence is the inconvenience of looking for these records when needed in the future. So my recommendation is to make sure that you have a complete collection of your medical records. Okay. Then make sure that they don't get lost. Okay. So keep the medical records that you collected. Okay. So samples of medical records that is being collected by these patients. Okay. So notes from me, and then histopath, laboratory findings, results, etc. Okay. So what to do? Okay. During confinement naman, okay, a lot of times physicians get and keep the diagnostic reports of patients during consultations. Okay, not really confinement muna, okay, in the clinics. Okay, when you consult a doctor in the clinics, now a lot of times these doctors keep the diagnostic reports that you give them, okay, during consultation. And then when you are confined, okay, they don't usually return to you properly, okay, or completely, okay. So what to do in such instances? Have photocopies of your records. Make sure you have the original copies so that once, if you give the doctors a copy, it should be the photocopy. So you have the original, okay. And then make sure that the hard copies of the diagnostic tests like films and other hard copies, no, make sure that they are returned to you if they are borrowed from you by the residents, by the doctors when you are in the hospital. What are ways of archiving medical records? I'm done with generating, then keeping, then archiving. Archiving medical records means placing the collected medical records, one, in a specified arrangement system, by which they can easily be identified and retrieved when needed in a specific place where they can be easily retrievable, makukuha kagad, makikita at makukuha kagad, with measures to safeguard from privacy issue and loss. Okay, mga private confidentiality and then the loss. Okay. So arrangement first. Okay, so you can arrange by folder system based on dates the medical records were generated, and then by types of medical records, if serial, if you have 2 or 3 medical records of the same type, then of course their date included there. Example, when you have a series of thyroid function tests, then you arrange them chronologically, okay, in terms of the dates in terms of dates arrangement. Now, in a specified place where they can easily be retrievable, you identify a specific place in the house or outside the house where the hard and soft copies of medical records will be stored collectively and on a long-term basis. And always remember where you put them. Okay, so it's really your call. Okay, now for digital copies, identify where to store and remember them again. Okay, so you can store them in iPad, in laptop, and desktop, etc. And you can also put them in the cloud, like email, blog sites, etc. And you can also put it in a USB or external hard drive, etc., etc. Okay. Measures against privacy issues. Okay, so just keep them private. It's really up to you how you gonna do about it. So that's why I said it's your call. Okay. Now for the loss issue, okay, have a backup. Okay, again, how you do your backup, it's your call. Okay, but always remember how you did your backup and where is the backup. Example of having a backup would be you can back up your hard copies with soft copies. Okay, that's one way. Then you can also have several hard or soft copies as a backup. Okay, and then placing the backup in another remote physical sites or place in cases of fire. Okay, example, if your house get burned down, sana di mangyari, no? All the records will get lost. But if you have a backup in another place like your office or another nearby house, whatever your place of work, you can put it there. But as long as you keep them confidential, then you will not be losing all the records. Samples of techniques in keeping medical records by patients that I have experienced, the simplest will be just to put them in a folder. Okay, pwede na rin. Okay, basta just make sure that it's complete and then it's, you know where it is. Okay, and then it's safe from fire. Okay, and then another way is putting it is folder. No, okay, and then staple it or put the fastener, and then put using the clear, what do you call this? Clear folder. Okay, just insert the records inside the plastic. And then this example of a patient's records. Okay, long term. Kaya maraming records. Folder 1, 2, 3, 4, 5. Dami, no? Okay. Okay. Some would also, in some people would also go to the extent of summarizing all the past events. Okay, like this one. Okay. Okay. With dates and then with the place and then what transpired and then some notes. Okay. And then this example of how I put the hard copies for my medical records. Okay. So the last topic would be advocating statements and advice from me. Okay. Have the records of your physical and mental wellness and illness from birth to current age or current time. Okay. Update these records every 3 years at least or earlier as indicated. You can ask a physician to help you organize the initial comprehensive medical records. I personally can offer this medical service if you want. Okay. And then ask for copies of medical records from your attending physicians whenever you seek consultation, whenever you undergo a procedure, both diagnostic and therapeutics, and whenever you are confined in the hospital, always ask for copies of the medical records. Keep copies of all the results of laboratory, radiologic, and other medical procedural examinations that you went through. Lahat. Huh? Don't leave your medical records to your physicians, to your doctors, without making sure that you have the original copies for your file, or at least another copy, if not the original. Pero pinakamaganda, the original copies. Records left or given to your physicians may get lost. It is difficult to ask the physicians for your medical records that you have left with them, especially when you decide to see a second or third opinions with another doctor, with other doctors. Okay. Kaya, di ba? Okay. Bring copies of your medical records whenever you see a physician, whether new or previous ones. Bring the latest records at least. Okay. For the new physicians, they will need your previous medical records to facilitate the medical consultation and the treatment. For previous physicians, they will need your previous records for a review. Okay. And then the previous physicians sometimes may not remember the results and informations in the previous consultation and treatment. So they would like to see your old records if they don't have their records in their clinic. Okay. As I said, okay, sometimes doctors also lose their records in the clinic. Okay, so that's why always have a copy of your medical records and bring them to the doctor's clinic whenever you consult. Okay. Have digital copies of your medical records. Scan paper copies of existing medical records. Digitalize your records. Digitalizing your records is an efficient way of doing archiving and safekeeping. And number two, digitalizing records comes in handy when doing telemedical consultation or communication. Nowadays, frequently we conduct telemedical. So always have, as much as possible, digitalize your records also. For records disaster preparedness and recovery program, have a backup of your medical records in case one set gets lost. So make sure you place a backup copy in an off-site, meaning away from the usual site. Okay. So that ends my talk, but I'll just put a summary. Okay. So takeaway here. So I've discussed all these topics. What are medical records from the lay people's perspective, common types of medical records, uses, why is it important for you to generate, keep, and archive? What are ways of generating, keeping, and archiving medical records? And then what are my advocating statements and advice on medical records? Takeaway in relation to patient empowerment, be always in touch with reliable medical information and the importance of medical records, particularly on how to generate, keep, and archive. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain control, greater control over decisions in the medical management of yourself by knowing how to generate and keep and archive medical records. That ends my pep talks. I hope I have empowered you to have a better understanding of the importance of generating, keeping, and archiving medical records in your health management. As a reminder, before we go to the QA portion, take the OLETE. Okay. 50 OLETE certificates, equivalent to 1 voucher for ROJoson telemedical consultation. Okay. And then those who are not taking the OLETE, please put in your feedback in the chat box. And then let's now go to the second picture taking before we go to the open forum. Okay, get ready. All set? All set. One, 2, 3. Okay. So the floor is now open for questions, reactions, comments. Okay. Anything that you want to say? Okay. How many of you have a good practice of keeping your medical records? Show of hands.
This is Susan.
Susan.
Doc,
Yeah.
this is Susan. I'd like to say something.
Yeah, sure. Go ahead. Go ahead.
I don't think I can hear you. Do you hear me? No.
Yeah, I can hear you. You cannot hear
There's
me?
something wrong with the sound.
About the others, can you hear me?
Can you hear me?
Yeah, I can hear you.
Yeah.
But I don't hear you from my side. I have to adjust perhaps my cell phone.
Ladies, can you hear me?
The others can go ahead. Something
hear
is
you.
wrong with my sound.
Sige, go ahead. You fix your sound system muna. So you have not heard what I'm lecturing a few minutes ago? Wala, hindi mo naririnig, Susan? Sayang. Anyway, sige. Any other questions?
Wala pa ho sa chat box. Ay, wala pa. Ako na lang po magtanong.
Sige.
Doc.
Oo.
Lang po, yun ho bang prescription ng, do we have to keep the prescription ng mga doctor?
Mas maganda.
Or
Mas maganda. Kahit na pangit ang sulat. Mas maganda. Okay.
kasi ang tendency ho natin, tinatapon na pag nakabili na ng gamot or
Oo, tendency.
so rin.
Kung malilista mo kagad sa isang papel, okay lang 'yon, no? Jot down the names of drugs also, no? Okay. Now, but as a supplement, pwede mo itago if you kung pwede, itago mo rin, no? Okay. Lalo na kung minsan hindi mo ma-decipher yung yung handwriting ng doktor sa prescription, di ba? At least if you show it to another person, baka ma-decipher nila kung ano. Or even the pharmacist, sabi sa pharmacist, pag nagpresenta kayo ng isang prescription na hindi mo mabasa, pakisulat na lang kung ano talaga ito para for my records, no? Okay. I encounter a lot of problems also with those prescription of other doctors. Whenever I ask the patients, ano binigay sa iyo, hindi mo matandaan. Pakita nga yung prescription sa akin, no, na binigay sa iyo ng ibang doktor. Kapag nung binigay sa akin yung mga prescription ng ibang doktor, hindi ko rin mabasa. So yan ang issue doon, no? Yung mga handwriting ng mga doctors also. The doctors, no? Okay.
May comment po si Doc, may comment si Jacqueline Tong. Dr. Joson, you have one of the nicest and legible handwritings for a doctor.
Thank you. Baka sabihin mo sa akin.
Hindi, totoo yan. Kasi many doctors' handwritings, hirap intindihin yan.
Yeah, I know.
Maybe because in med school, they were always in a rush jotting down notes. So, puro shortcut ang ginagawa nila.
Hindi tama yun. Sa med school,
sorry?
Ang usual practice sa medical school, to tell you guys, yung mga hindi kayo mga doktor, pag nag-a-attend kami ng lecture, no, hindi kami sumusulat, may isang may isang may isang scribe na parang secretary.
Oh,
And then ibibigay na lang sa lahat, sa buong members of the class. Yan ang
see.
style ngayon eh. Na bihira yung nagja-jot down ng notes yung mga estudyante. They just assign by rotation sinong kukuha ng transcription of all the lectures. Then ibibigay sa lahat ng mga kaklase niya, kaklase namin.
Aha. Okay.
So anyway, it really depends on the discipline of the doctors also on how to magpangit ng talagang tsaka yung compassion. There must be compassion, no? They know that their poor handwriting can get some patients into trouble, di ba? Yung mga the risk of having a poor writing, poor prescription. Kasi baka hindi na misunderstood ng pharmacies or even the nurses. No? Even sa hospitals, kuminsan hindi mabasa ng mga orders ng mga doctors, no? Mga nurses. No? So, okay.
Doc, may comment si Susan Argel. Sabi niya, you were the only doctor who gave me a written copy of your diagnosis. Isn't this not required from all doctors?
Paano ko sasagutin yun? Isn't this required? wala pang law diyan. Pero in terms of medical ethics, na dapat magbigay sila, na okay. That's why I said I wonder bakit hindi sila bibigay. Pero pag nasa hospital ka, may record sila di ba? They put something on the chart, no? And which you can get a copy, di ba? Baka probably, I don't know, probably in the clinics nagmamadali sila. Okay, nagmamadali sila, no? Ayaw nilang matagalan, no? Okay. So I cannot really impose this to other doctors, but I would like to encourage them to do the same, no? Okay. Any other?
Doc, ako po, meron po. Itong lahat ng mga records natin na diniscuss ninyo, medical records, do we have a retention and disposition schedule or lahat ikikip natin?
Keep
itong
it
kahit na matagal na.
On a personal basis, yung retention na yun is up to the time of your death. Kasi kailangan mo pa, di ba? Kung sa hospital, ibang usapan 'yon, di ba? Hospital, they are required by law to keep it at least mga 50 years ganon, no? Ganon. Baka nagbago na, I don't know kung may nagbago na, baka they make it 25 years, no? But in the presence of this computerization, okay na yung 50 years, no? They can keep it basta may computerized copies, no? I said, in the past, they want to bring the retention period to a shorter time because of the lack of space for the hard copies. Di ba? Okay. Pero for the personal records niyo, tago ninyo. Okay? For the rest of your life.
Thank you, Doc.
No? Para magamit ko. Minsan, yung mga kamag-anak ninyo who will come after you, they want to know your past history also, yung family history. Okay, baka merong ma-influence dun sa mga sakit nila. Yung mga, let's say, yung mga kamag-anak mo, yung anak mo, yung ano mo, no? Okay. Okay. Any more?
Wala na, Doc, sa chat box unless there are other questions. Excuse me.
Yung mga nagko-consult sa akin, tinatago niyo yung records niyo, ha?
Opo.
Huwag niyo iwawala. No? During this pandemic, ang dali, no? Kasi whenever I had some telemedical consultation, I usually ask them, please take a picture of the records that I gave you in 2020 before the lockdown. No? So, binibigay sa akin. So, it was, kasi I cannot go to my clinic to get the records, di ba? So I have to stay in the house. Then, through that means, no, na napafacilitate yung aming consultation. No? Okay. Okay. Any more questions? So resolution natin, lahat, try to improve our system of keeping the medical records. Pwede? Okay.
Opo. Yes,
There will
Doc.
be one thing that we will get out from this pep talk is that the resolution that at least from now on, you will keep your medical records now. But you can go beyond that. You try to retrieve all your past medical records. Kahit na ilagay mo lang sa isang lugar, no? Minimum, no? Okay. So if you don't like to archive it, to arrange it properly, basta ilagay mo sa isang lugar, no? So when the time comes, you will find usefulness in what you're doing also, no? Okay?
Okay, Doc.
No more? Wala na, last call. We still have 9 minutes actually, 8 minutes. No? So kung wala, next, the topic that I was thinking of next week will be cancer curability and survivorship. No? Cancer curability and survivorship. Okay. Then this will be followed by cancer incurability. Baliktad naman. Cancer incurability and hospice care. Nah? Okay. So I'm looking forward for these two lectures. I'm still preparing for these two lectures. I know it will be of great interest to all of you people. Nah? Okay. Cancer curability yung next week and survivorship. No? Then the week after will be baliktad naman, cancer incurable. Now, when do we say that the cancer is already incurable? Now that you don't really have to waste time and money to run after it. Now, to run after the disease. Now, and then hospice care, how to take care of yourself, of somebody else, in the last stage of the disease. Now, ganon. Okay. So if there are no more
Okay, Doc.
questions, we'll call it a day. Maaga tayo matapos today. Okay. Sige.
Thank you, Doc. Thank you very much.
Bye-bye.
See you
Thank
next
you,
Sabbath.
Doc. Thank you so much, Doc.
Bye-bye.
Yes, thank you.
You're welcome.
Doc.
So Susan, na ano mo na? Invoice, nasaan mo? Naayos mo na?
Narinig niyo ako, Doc?
Naririnig mo na ako?
Ayan, naririnig ko na kayo. Meron yata akong napindot. Now, I have to go over my records but I threw them away, yung mga endoscopy tsaka colonoscopy.
Nako.
Kasi ang hahaba, no, binigyan pa ako ng mga litrato.
Tago mo lang. Basta i-file mo lang.
Na nga eh.
Sayang.
Oh, and that was mga 15 years ago pa.
Importante rin yon. Ano eh, kung wala na, what can you do? No? Okay. So
Actually, it was paid by my HMO noon. Wala na akong HMO ngayon. Kaya I cannot, pero wala naman basta yung doctor na basta yun, binigay lang with mga photos, marang ganon. Wala naman binigay na medicine or what. So apparently okay ako after all those tests.
And you just jot down na lang. You try to recall na lang. Make a journal that you had this one. Try your best lang that you have this one. Everything is normal. Ganon. Okay. So in the future kasi, if you have symptoms like stomach and ganon, no, the doctor will always ask you what transpired in the past, di ba? They will always ask that. No? Okay.
Okay, Doc, I know. Now I have to really come up with the journal. Because medyo magulo ang aking files ngayon eh. Well, fortunate my file of your two diagnosis handwritten is with me. And I have a folder which states your name. And I'm supposed to see you again dapat after 6 years.
Okay. Try your best na lang. Compile mo lang.
Okay, Doc. Thank
Okay.
you.
Okay.
Bye.
Sige. Bye-bye.
Bye.
Okay. So let's call it a day. Bye-bye.
Yes. Thank you.